All right, everybody see the screen? Great, okay. Yeah, so as Dr. Drummond said, my name is Deb Hendrickson. I'm a pediatrician here in Reno, Nevada, and I'm a clinical professor of pediatrics at the University of Nevada School of Medicine. I am going to talk today, I'm expanding on what I talked about at the University of Arizona last month to just really zero in on wildfire smoke and children's health. Reno is the fastest warming city in the United States, but it's not the hottest, but it's the one with the fastest rising temperatures. But we're also one of the smokiest cities in the United States, and that's largely because we're 10 miles from the California border. We're right at the base of the Sierras, and so we get a lot of the increase in fires in California has meant that we've had a really big increase in smoke. And this is a photo on the title slide of the Yosemite Rim fire in 2013. And this was really the first big mega fire we had. That's a fire over 100,000 acres that really affected Reno's air for a good length of time. And it was the launch of this more than a decade of these kinds of events that we've had since. The day that this photo was taken, so this is taken down by Yosemite National Park looking northeast, and Reno is kind of in the upper part of this photo somewhere in there. The day this was taken, a little girl came into my office. She was 10 months old, and she was wheezing and coughing, struggling to breathe. Her mom brought her in, and I put her up on the table, and ash was falling outside the window like snow and like ghosts. And it was just this apocalyptic scene outside. And I was just looking at this little girl's face, and her mom said to me, isn't it funny how you never think about breathing until you can't? And as Brian mentioned, I was an environmental analyst. I had a background in environmental science. I was an environmental analyst and planner for 10 years before going into medical school. And I'd actually gone to graduate school in forestry. So I knew that these big fires were predicted to be an effect of climate change. So I thought, wow, this is my past and current career kind of coming together. And that was why I started writing the book I wrote, which is called The Air They Breathe, that ended up being a book about all the impacts of climate change on children across the country. But it started with a story about wildfires and how it was affecting a little girl's breathing. And like I said, because I knew that increasing wildfires was one of the most significant impacts of climate change. Western US wildfires and in Canada as well, you probably know, are growing more frequent, more intense. They burn hotter, which has consequences for what kind of pollutants the smoke contains. They're larger in area and longer in duration than they used to be. And why is this happening? Well, more than 100 studies have found that that climate change is responsible. That it's increasing the weather conditions that lead to the fires. So we're getting hotter, drier summers and falls. We have what's called precipitation whiplash, where we might have a very wet winter or spring, followed by drought conditions for months afterwards. So all this vegetation builds up and then it becomes fuel for fires later. We're having more extreme wind events. Wind is almost always associated with the worst fires we have. And we're seeing earlier snowmelt and later snowfall, which is longer fire seasons. But there's other issues as well. One big one is that bark beetles are surging in these new conditions. They especially target trees that have been weakened by drought or other, illnesses. And large numbers of trees are dying. The photo I put on this slide, millions of trees have died in the Sierras. And so this makes especially the northern Sierras very prone to wildfires. We also have a past fire suppression, like of lightning fires. There was for a long time the belief that we should tamp fires down as soon as they started, but they are a natural part of the ecosystems out here. And that led to a lot of fuel buildup. And electric lines, our electric infrastructure has triggered a lot of the biggest fires, including, the Paradise Fire, the Camp Fire, and a lot of the wine country fires. And it may turn out to be the case in LA as well. So smoke exposure is by far the greatest health impact of the wildfires. In 2023, fire injuries, people directly injured by the fire itself, killed 130 people. That was an unusually high year because of the fire in Maui, which killed over 100 people. In most years, it's less than that. Smoke exposure, on the other hand, one study that was published in Science looked at just excess deaths. So they do epidemiological studies where they look at predicted death rates for a time and what we actually saw during and after wildfires. and after smoke events, and they found that more than 52,000 excess deaths were accounted for in California by smoke exposure, 12,000 of those in 2018 alone. Globally, smoke is estimated to cause 1.5 million deaths a year. And the difficulty is that it's, these effects are insidious. You're not going to ever code someone coming in as having a smoke illness, unless it's a very obvious, like respiratory illness from smoke exposure. But a lot of these diagnoses, it's insidious, it's invisible. It's things like heart attacks, strokes, COPD, kidney failure, and cancers. And so because these things occur without smoke as well, we can't know which individual person has a case because of smoke. We only know when we look at big epidemic that the smoke is increasing these diagnoses. Now, everyone is harmed by smoke. We see these effects across the age range, but children face some unique risks. It's estimated that 7.4 million children a year on average over the last decade have been exposed to wildfire smoke, mostly in California. The younger you are, the bigger the risk, and I'll show why as I get through the lecture. Fetuses, babies, and toddlers are most at risk, partly because they have a different physiology. We often say in pediatrics, children are not just small adults. And what we mean by that is their bodies work differently in ways that make them more susceptible to environmental injury and harm, especially. They're smaller, so the same dose of air pollution for a baby or a toddler is pound per pound going to be greater than for an adult, just like a medication. But maybe most important is that their organs and body systems are still forming and growing. And I'll give you some examples as we go along of how environmental hazards can throw those developmental processes off target, off their normal path. And this brings up one of the major themes that I go through in my book, excuse me, which is that children's bodies and minds develop through interaction with the world. This is especially true of the lungs and the brain. The lungs literally form through interaction with the quality of air children breathe. The brain is also, we now know, very affected by air quality and, of course, by the experiences children have in early life. Now, where are kids, or where are all of us at risk? This is the FEMA National Risk Index. You can see that if you include relatively moderate risk, they consider more than half the country to be at some risk of wildfires. But if you look at just the very high and relatively high areas, there are fewer, but it's still big swaths of the country, mostly in the western US. And Arizona, where you guys are, is a high-risk state. I think you had about 1,600 wildfires last year that consumed about just under 180,000 acres. But California is by far the king of wildfires, the main battleground of where this is an issue. The state historically experiences more wildfires and acres burned than any other state. There are more than 4 million acres burned in 2020, which is the most ever. California battles thousands of wildfires every year. There were over 8,300 last year. There's been up to close to 10,000 some years. And one of the big issues that's emerged over the past decade as these fires have gotten bigger and more explosive is this urban forest interface wildfire, or urban wildfire. These have increased. The big examples are the Santa Rosa fires, the wine country fires, the Paradise Fire, the Camp Fire in 2018, and the Los Angeles fires that we just went through. And urban fires create new kinds of health risks because of what is in them. And I'm going to give just a quick example. So this is a map of the wine country fires that took place in 2017. In my book, I talk about a little girl and her family. She was 5 years old, who had to flee the Tubbs fire in Santa Rosa in the middle of the night. And the Tubbs fire is shown on this map. Since 2015, the wine country, this area of California, has experienced 18 major wildfires. There's hardly anything left to burn. And each one of those has completely engulfed the Bay Area, where millions of people live, in toxic smoke. This is an outline of the fire, and this is where it started at 9:43, and it was an electrical line fire. Just like I mentioned earlier, the electrical lines are causing a lot of these. And by 2 o'clock in the morning, 2:15 in the morning, it had swept down into central Santa Rosa and completely consumed a neighborhood known as Coffee Park. So the little girl I profiled woke up to sounds of crashing and doors slamming because it was very, very windy. And I talk about, there was in the story I tell in the book, that there was a willow tree in the yard that was on fire. and that they had to flee for their lives from this fire. And this is what it looked like the next day. That's the willow tree that I talk about in the book that was in their front yard. And the picture on the left, you can see, the edge of the fire. But if you stood at their property and looked west, all you could see for miles was a field of ash. And I wanted to show these slides because it's important to realize that what the people downstream are in the area are breathing is the vaporized remnants of, homes, cars, businesses, anything that was in the garage, all the toxic chemicals. And you can see in the photo on the right that the air pollution is still there after the fire's been put out. And we're seeing now in LA that it is persisting for a while, that these are high-risk zones for quite a while afterward. And what's happened in the wine country is just a microcosm of the entire state. This is a map that shows for the 100 years between 1920 and 2020, where the fires were and how big they were. And you can, if you look at where the blue and magenta and pink are, you can see that dominates this map. And if you look at some of the older fire colors too, you can see that the fires are bigger than they used to be. And if you look over here, you can see here's Reno, where I live and practice. And you can see why we're so at risk from wildfire smoke, because we're right downstream. There's two major mountain ranges in California. This is the Sierras, and this is the coastal range. And so both of them are being hit very hard by these fires. And one of the trends that's happened, as I said, is the fires are getting bigger. So this thing called a mega fire, which is a fire over 100,000 acres, which was almost unheard of before the last quarter century, now dominates most of the fire. It's a very prominent event in the fires that we're seeing. And in fact, 17 of the 20 largest wildfires in California history have occurred since 2000. So what is it, what's the impact on people downwind? Well, this is my hometown. This is where I live right now. This is what it normally looks like. And of course, here are the Sierra Nevada mountains, and the clinic I work in is over here to the right. And this is what it looks like when the smoke rolls through town. And we've had wave after wave of this over the last 10 to 12 years. This is during the 2018 Mendocino and Carr fires. It's a pretty egalitarian event in that everybody in town is affected, so it's probably less affected by income than some of the other impacts of climate change. However, low-income families are more at risk because these events tend to also come during hot periods, and lower income families often are less likely to have air conditioning or to have weatherized their homes, and their neighborhoods tend to be hotter, so they're going to be running they're either going to be opening windows or running swamp coolers more than better off families. This is a swamp cooler if you haven't seen one before, and a lot of families, especially in areas that didn't historically need air conditioning, like Reno, a lot of families have these, and the trouble is that they suck the polluted air right into the house. So low-income families, especially if they have somebody with a respiratory problem, are going to be more at risk in the fires. These can be retrofitted, but not many families, know that. Now, what are we all breathing when this happens here and everywhere else that's experiencing these fires? There are three main categories of pollutant that are in wildfire smoke: gases, particulate matter, and toxic chemicals and heavy metals. And the particulate matter by far is the pollutant that is thought to cause the most problems related to the fires. It's the most thoroughly studied. And in every study you look at of wildfire smoke, it's the particle matter that is causing the greatest health impact. And I'm going to be using the terms particulate matter, particles, and particulates interchangeably. They're synonymous. We talk about particles in terms of their size, whether they're coarse, fine, or ultrafine. The 10, 2.5, and 0.1 are micrometers, the diameter of the particle. And part of what makes the particles so dangerous is that they're bound to toxic chemicals and heavy metals, vaporized heavy metals that they've mingled with in the smoke. Most commonly polycyclic aromatic hydrocarbons, but also volatile organic compounds like benzene and heavy metals. So this makes them more inflammatory and more dangerous. But gases are also a big part of what's going, what we're inhaling. Ozone, ground level ozone, of course, is a pollutant on its own, but it's also found in very high quantities in wildfire smoke. And one study estimated that 2,000 pediatric ER visits a year in the West are due just to ozone from wildfires. We also see carbon dioxide, nitrogen dioxide, sulfur dioxide, and carbon monoxide. And I want to point out that with the exception of carbon dioxide, all of these pollutants are pollutants that are regulated and measured by the EPA, under the Air Quality Index and the Clean Air Act. And I also want to point out that 3 of these gases are also greenhouse gases. And so one of the problems we're running into is that they're creating a feedback loop. The rimfire that I had on my title slide, for example, released greenhouse gas emissions equivalent to the annual emissions of 2.3 million cars. And so I just want to bring this up too, because fossil fuel emissions, we know, have huge impacts on the quality of air we breathe and huge health impacts. Millions of people a year die from fossil fuel emissions, but because the impacts are so insidious, like I said, so difficult to attribute directly to fossil fuels in each individual case, it escapes most of the public's attention. But they also have this indirect impact on the air we're breathing through increasing wildfires and urban smog, ground level ozone, that's increasing in cities because of rising temperatures. So, the Lancet said that climate change represents the greatest health threat and the greatest health opportunity of the 21st century, because even if without global warming, fossil fuels cause so many health problems. But when you add global warming in too, this is, we'll look back on this wondering why it took us so long to get off of these fuels, because of their impacts are so widespread and profound. I wanted to talk just a little bit about the air quality index because it makes it easier to understand the maps you see when these fires hit. The EPA establishes an AQI for the 5 major pollutants that are regulated by the Clean Air Act, which I've already listed. The AQI is calculated for each pollutant, and the pollutant with the highest concentration determines the level for the day and is noted as the responsible pollutant. And air quality improved a lot due to the Clean Air Act, which was passed in 1970. But climate change is creating new challenges. So like a city like Reno, we can't do anything about the main driver of our poor air quality, which is wildfires from California. So we get an exception from that under the regulations. But a lot of other things we're trying to do to improve air quality here are not going to affect the biggest problem we have. But if you look at this chart here, so the level, if they say it's 0 to 50, that's green. So if you see green, that's air that's considered healthy. Moving your way up to red, purple, and burgundy, which are, unhealthy, very unhealthy. See a map like this during wildfires. This is the 2020 fires that, the whole west coast of North America was affected. You can see there are just millions and millions of people breathing terribly, hazardous air, whereas the rest of the country looked pretty good. And from space, this is why I couldn't find a photo from the exact same day, but you can see, the smoke just completely engulfs huge areas of the country. So as I mentioned, the most dangerous impact of that, the pollutant we worry about the most in the smoke is particles. Particles are the microscopic soot and droplets that are found in the smoke that are, as I said, bound to heavy metals and toxic chemicals. Now, the smaller the particle, the more invasive and dangerous for human health. This graphic here on the right tries to demonstrate that. So these very tiny ultrafine particles, which are produced in huge quantities by very hot, large fires, they can penetrate through the bloodstream of the lungs and travel through the lungs into the bloodstream and travel to any organ of the body. And so this is why the health impacts of particle pollution are so widespread and diverse in terms of the number of things you see from them. We all recognize the respiratory effects of the smoke, but it's more difficult to see these downstream effects. In 2018, fossil fuel particles alone, so not wildfire, but fossil fuels, caused 8.7 million deaths worldwide and 13% of all deaths in the US. So again, even without wildfire smoke, fossil fuels cause some of these problems, and wildfire smoke is just making it worse. We know that when particle levels rise in a city, so does the non-accidental death rate. So the death rate from all kinds of diseases and diagnoses. The adverse effects we think are mainly due to inflammation and in children in the physical disruption of normal developmental pathways. One of the big debates as wildfires have gotten worse is, are the particles in wildfires better, worse, the same as those from fossil fuels? Because you could fill up the room you're sitting in with the studies that tell us that the particles from fossil fuels are really bad for human health. So as the fire started to escalate, a lot of epidemiologists and public health officials wanted to know is, how do we compare what we know with these new types of particles? And I just tried to graph here. One of the issues is the exposure is quite different. If you're in an area, like a red-lined area, low-income area with chronic emissions, you're getting kind of a chronic daily exposure. But with a smoke wave, you get these episodic, very terrible events like that AQI map showed. And some of the variables that would determine which is worse is the dose you get, the duration you're exposed to it, patient's age, the very young and the very old are more at risk, the source of the particle and its composition, what's it adhered to. Unfortunately, we know from animal and epidemiological studies that wildfire particles are more inflammatory than fossil fuel particles. Every line of evidence we have so far is indicating that. We know that the same dose, now, there's one big study that showed that the same dose of wildfire fine particles increased mortality more than an equivalent dose of fossil fuel fine particles. And a multi-year study in San Diego County found that fine particles from wildfires were roughly 10 times more likely than particles from fossil fuels to cause breathing problems in children. So unfortunately, the evidence is that this is even a worse problem than fossil fuel particles, but the time exposure is more limited. One of the other issues is that these particles can travel thousands of miles. 65 million Americans were exposed to unhealthy levels of wildfire particles from 2020 to 2022, according to the American Lung Association. This shows smoke from the Caldor and Dixie fires in California, which made our air awful for about 10 weeks that year, and also fires in the Pacific Northwest and Oregon. But you can see the effects were felt all the way to the East Coast. And the same thing happened in 2023 with the Canadian wildfires. So particles are linked to many adverse effects in children. Respiratory illness and infection. I think you guys were talking a little bit about infection and air pollution, it sounded like. Perinatal complications, neurodevelopmental delays and disorders, and then just a long list of organ and system impacts. I'm going to review some of the data on these issues and then just talk briefly about diabetes and immune system impacts. But I just want you to be aware that pretty much any place people have looked, in adults and children, for whether particles have an impact, they have found an impact. The impacts are widespread and diverse. So why are children, talking first about the respiratory impacts, why are children more vulnerable to the respiratory impacts of air pollution? Well, first of all, they breathe faster and they have a larger relative lung surface area. So that's more, that means they're inhaling more air pollution per pound of weight. They're closer to the ground, if they're up and walking, and that's where pollutants tend to settle, and they play outside more, at least they used to, but hopefully they play outside more. They tend to mouth breathe more, so they don't get the filtering benefits of the nose. And the lining of their airways are more fragile and can be more easily damaged, which then allows the particles to more easily penetrate and get into the bloodstream. One of the most important reasons they're more vulnerable is that 80% of lung growth happens after birth. And we know from long-term studies of kids living in some of the most polluted neighborhoods of Los Angeles that chronic exposure to fine particles in childhood stunts lung development. The kids actually have smaller, stiffer lungs, and that has lifelong implications for their employability and their health and their lifespan. When those kids moved, some of those kids moved to healthier neighborhoods with cleaner air, they actually could recover on 10 to 12% of their lung capacity if they moved between the ages of 11 and 18. But once you hit 18, your lung growth is basically done, and there's no way to fix the damage that's been done by air pollution. And of course, acute exposure, so that's chronic exposure. Acute exposure, like is experienced in a smoke wave, leads to increased visits for asthma and other respiratory illnesses. This is again that rim fire that I showed you in the opening slide, in my title slide. This was data collected by a local research group, The purple lines are asthma visits, and you can see during the winter viral season, we have a spike, and then this is, summer and spring. And we have a heat wave, hot days, followed by a big PM 2.5 spike, and about 2 days later, a big spike in asthma visits. And they used a very limited code for asthma. I think it would have shown a much bigger increase if they'd used a broader list of ICD-9 codes, because this was before the ICD-10s came in. And multiple studies have shown that pediatric ER visits and hospitalizations for respiratory symptoms increase during wildfires due to fine particles and smoke. The risk appears to be greatest in the first 3 days, and especially in those under 5 years old. One example, a fire that was studied in San Diego from 2017 called the Wildfire. They found a 16% increase in pediatric ER visits for respiratory symptoms as a result of the fire, as a result of the fine particles in the fire. But particles harms start even before birth. We know now because of, mainly it started with this study by Beauvais in 2019, that in the box there, they're pointing out black carbon particles, so fine particles that are actually in the placenta. We know that the particles can cross the placenta, and that the higher the maternal exposure to them, the higher the concentrations on the fetal side of the placenta. And many studies now have linked adverse health outcomes to this prenatal exposure, especially preterm birth and low birth weight, which both go up when moms are exposed to particles during the pregnancy. Globally, 2.5 million preterm births a year are triggered by some type of particle pollution. And the fetus is especially vulnerable because it's still forming. Prenatal exposure has been linked to congenital heart defects, especially atrial septal defects, cleft lip and palate, gastroschisis, and impaired lung development. So it doesn't just impair lung development after birth, but also it seems to have some kind of epigenetic effect that affects prenatal lung development as well. I mentioned the overall mortality from smoke, which is almost entirely attributed to particles, but there's also an infant and child subset of that. Globally, 40% of all deaths from wildfire smoke are children under 5 years old, mostly respiratory causes. And the rate of child mortality rises with the concentration of fine particles in the smoke. Some studies have found a link between SIDS, sudden infant death syndrome, between the incidence of that and air pollution, specifically particles and nitrous oxides. Columbia University did an analysis and found that because of the particles from US power plants, the plants that generate our electricity, that if we converted to renewable energy, it would probably save 2,500 infants' lives over the following 3 decades. So particles also, we now know, injure children's brains. It doesn't, as I mentioned, stop at the lungs. They alter brain development through either direct invasion of the brain tissue or systemic inflammation, and the effect that that has on brain development. This has cognitive and behavioral consequences, and there's a number of studies now showing that, or suggesting that it's contributing to autism, ADHD, and dementia rates, all of which, have been rising. And again, it's because most brain growth happens before age 3, which makes fetuses, babies, and toddlers especially susceptible. And I wanted to go into this on more detail because I just think it's a really, really important thing that most parents do not know about. If you're a pediatrician, you get asked constantly about the link, but the non-existent link between vaccines and autism. So I've spent countless hours talking to families about that. I have not yet met a family who knows that there's a link, that's a very well-established and growing link between air pollution and fossil fuels and cognitive and behavioral and brain abnormalities, neurodevelopmental abnormalities. So this is one of the most startling studies, I think. This is the Mexico City brain studies. A group of researchers led by someone from the University of Montana found that brain MRIs from children raised in very polluted Mexico City air, they compared those to those of children from a city in Mexico with clean air. And of the kids who were growing up in Mexico City, 56% showed prefrontal neuroinflammation. And they also found this in the city's dogs. These children, when they were tested, had significant cognitive deficits. And then in a subsequent study, they did brain autopsies on, people who had died accidentally, on babies, children, and young adults from Mexico City. And they showed that in these prefrontal areas, particles were the cause of the inflammation that were embedded in the brain, and that they were encased in Alzheimer's-like plaques in nearly all cases, in all but one of the cases, suggesting that these kids, even at a very young age, even in infancy, were being predisposed to later dementia, and because of the importance of the prefrontal cortex to cognitive problems in executive function, and just coping, and then personality effects. So the particles were ascending, in this case, through the nose. The reason they were in the prefrontal cortex, they were ascending up the olfactory nerve into the front of the brain, which you can see in this, is shown in this slide here. Another example, and these are fossil fuel particles in these 3 studies, I want to be clear, but as I mentioned, the wildfire particles are thought to be more inflammatory than this. So this is just an example, just to show you what we know. There was a coal-fired plant in China that was scheduled to be shut down in 2004. So a group of researchers assembled a cohort of pregnant women from the downwind community. They enrolled them in 2002, and then another group of pregnant women and their babies from 2005. And then they measured the levels of polycyclic aromatic hydrocarbons, which again, are those chemicals that are adhered to particles in newborn cord blood. They measured that and then tracked the children's development and growth over time. And they found that the babies who were born after this plant shut down had significantly lower cord blood PAHs and significantly improved development and head growth. And finally, from Southern California, there have been a handful of studies now that are showing an increased autism risk when moms are exposed to particulates in pregnancy. There were nearly 300,000 women were enrolled in this, mother-child pairs were enrolled in this study over more than a decade at Kaiser Permanente hospitals. And they had various ways of modeling and tracking how much of fine particles the moms were exposed to. And they found that children of mothers who were exposed to elevated fine particles in the first 2 trimesters had a statistically significant increase in autism spectrum disorder, and that the effect was larger in boys. So those are kind of the neurologic impacts. I just wanted to talk a little bit about immune system effects. This will be relevant to your discussion about infections and allergies. A Stanford study published in 2019 compared air pollution from a single wildfire and a controlled burn of the same size. That's where they come in and cut the trees down and organize them and burn them in a controlled way. The wildfire produced more air pollution. It was actually a megafire. And the children who were exposed to the wildfire smoke were found to have epigenetic changes to a gene that was needed to form T cells. So these kids made fewer, less healthy immune cells, which raised their odds of later allergies and infections. And the authors, one of their conclusions was it's better to do the controlled burns to try to reduce the fuel load than to let these fires burn themselves. We also know that prenatal exposure to particles or particulates has also been found to alter lung immunity, which raises the odds of asthma, allergies, and lower respiratory tract infections in newborns and toddlers. So even prenatal exposure is having some effect on the infections and allergies and asthma later in life. Something you might not expect, that air pollution has also been linked to diabetes. Type 1 and type 2 diabetes is increasing globally in both kids and adults. Air pollution has been linked to these trends. Wildfire fine particles have been associated with a greater risk of diabetes-related hospitalization than other sources. And again, showing that they're probably more inflammatory. The mechanism seems to be increased oxidative stress, inflammation, immune system disruption, and insulin resistance. And just as an aside, rising temperatures are also a risk factor for type 2 diabetes, with one study calculating that each 1 degree centigrade rise in mean annual temperature will result in 100,000 new cases in the US. Finally, for anybody who's lived through one of these events, you know that they have a big effect on mental health. I mentioned that in 2021, we spent 10 weeks in terrible air because of the fires up by Lake Tahoe. And you just see people's mood and anxiety increase. And it's a very difficult thing to face day after day after day. And it's been linked in studies to pediatric crisis presentations, especially in teenagers. Wildfire smoke seems to be more toxic than other kinds of air quality. In this respect, too, a study in Western states showed a 6.3% increase in crisis presentations for anxiety during wildfire events. That was all ages. But in children, there was a study that showed each additional day of elevated particles was increased the risk of later mental health problems or concurrent or later problems in 9 to 11-year-olds for up to a year later. So what can we all do about these? This is kind of the standard advice I give parents. If the AQI app says that it says it's over 100, keep kids indoors. This is a screenshot of my phone during the fires in 2021. So this is my neighborhood. But so have them download this app on their phone, and usually if it's really bad, people know just by looking out the window, but this can give them, if it's milder than that, can give them some indication of whether it's safe or not for the kids to be exercising outdoors, for example. If they have an HVAC system that can handle a high grade filter like a MERV 13 filter, that's one thing that can remove particles from indoors. Air purifiers like this one here, that's the one I have in my house. That one has been rated highly because it can clear a large room of 99% of particles within a half hour. There's others too, but that's a really good one. And most people in Reno who can afford them have a lot of them in the house. You can also build them from instructions online. Kids who are old enough should be wearing an N95 mask if they're going outside in the smoke, or young children should have a damp baby cloth over the baby seat, damp cloth over the baby seat. A lot of us have air quality monitors, again, people who can afford them, for indoor, outdoor. There's a company called Purple Air that this is one of their outdoor air monitors. They also make an indoor monitor, and they are now making individual monitors that you can put on a child or an adult to see how much they're getting exposed to as they go outside to work or run errands or whatever. And then in advance of the fires, one thing that can help a lot is weatherizing your home, because it both saves energy costs and will help the family in that way. And there are a lot of municipal programs that will help them do this at very low or no cost. But it also really helps seal the smoke out of the house. So that's a good thing to do too. I wanted to say just a word about what California is doing. So another adaptation that California has undertaken to try to deal with this. Over the last 25 years, they've invested $2.5 billion in trying to clear undergrowth, to improve the treatment and management of the forest. They've got more than 2,000 projects underway, and most of this money has honestly been spent recently. They've now cleared more than they're now clearing or treating more than 700,000 acres a year. And they found that in recent fires, the treatments have significantly reduced the damage to infrastructure, to homes and businesses, because they just slow down the fire enough that the firefighters can get in there and redirect it or get it under control. And one example of this was the Caldor fire in Lake Tahoe, which was barreling towards South Lake Tahoe, which is a fairly good sized city with casinos and all kinds of businesses and resorts. And it was contained and stopped because of a prior treatment that had happened in the path of that fire. But major fires are still a risk. There's communities up at Lake Tahoe where if a fire starts because there's no evacuation routes, they're going to be in really big trouble. And of course, one of the examples we have of major fires and the risks we still face was LA this past January. 38,000 acres burned and more than 16,000 structures were lost. I was in LA during the fires and helped a group of parents who were very concerned about the exposures that their kids were getting. And it's really difficult because we don't have timely data to really tell them most of the time what is going through the air, except for the AQI app, which doesn't measure a lot of the toxins and heavy metals that are in these urban fires. To try to address some of those research needs or those data needs, researchers led by UCLA are collecting data on the air quality impacts of the fires. This is a screenshot of a story that appeared in the New York Times about their work. And even what they are finding is that even in the burn areas, even when the AQI is normal, they're finding elevated levels of the volatile organic compounds, particulates, and lead, and other things. So the burn areas themselves remain dangerous for quite a while afterward because of these things being suspended in the air. And as part of this study, they're also monitoring residents' health over time to try to get a better handle on all the different factors that and on how the fire is going to affect people long term. I just wanted to say, so those are adaptations and studies that I think you just keep in the back of your mind while we're adapting and collecting data on fires. Remember that the key thing is that carbon emissions must start declining. We can't do anything about the damage that's already been done to the forests, but the longer this curve keeps going up, this is the rate of carbon dioxide emissions, the worse the fires are going to get. So anyway, so that is it. Anybody has any questions?
There was one question in the chat, Deb. Elise was asking if there would be access to this information later, if you could get, would be willing to share the slides, and I could.
Oh, sure.
The class.
It's a huge file because of all the graphics. But yes. Oh, thank you for sharing the book too. Yeah.
Thank you for the presentation, Dr. Hendrickson. I will be starting PEDS training this coming summer, so I'm very excited. And thank you for the talk. I really appreciate the slide you had about kind of like the anticipatory guidance or the conversations we can have with parents. So I was wondering if there's any kind of like initiatives or like outside resources that maybe we can connect families to. Especially the ones that are like living in vulnerable communities or where kids are more at like risk, like trach vent kids or anything along those lines that, again, we can provide more information or just connect parents to.
There's so much information online about these impacts, but I ended up producing my own brochure for my clinic about this to try to, because I couldn't find anything that said exactly what I wanted to say. And it's a difficult conversation because, if you're having a smoke event already, parents are already anxious and upset and worried about their kids. And so you have to balance what you're telling them with giving them things they can do for sure, because it's, part of your job is to reassure them and help them find a way to be okay in what's going on. So I'll look and see if I can find any handouts or, anything that's online that you could use. But like I said, I ended up writing my own for my clinic.
Yeah, thank you for that. And I agree. Like it's about reassuring the family. So I think finding ways for me and my future like clinic, or like just wording things specifically. So I can just be like the most support and help for the families. Thank you.
You're welcome. And I always, for families that are open to it, try to talk to them about things they can do when the fires aren't going on to try to reduce their own carbon footprint or get involved in the community in efforts to reduce the city's carbon footprint or the state's, to join with other people who are worried about this. And two really good groups are Mom's Clean Air Force and Our Kids Climate. They have a lot of materials on all kinds of health risks and what parents can do.